Mhm. You know, the other thing you just mentioned is the tremendous advances in the field. Those are really ongoing. So what does the American Board of Phlebology do to encourage people who are diplomates to keep up in the field? Because one of the things I love about being a vein specialist is that there are new things to learn all the time. So how does that happen? How can we make sure that people really keep up?
So that's a great question, and of course it is exciting that new developments continue.
Mm-hmm.
And what the ABPH has done is develop the maintenance of certification program, which is very typical for boards, where they require their diplomates to keep up with a certain amount of continuing medical education on a per-year basis, along with other kinds of requirements. Just for that reason, because it's really about lifelong learning and a commitment to continue to develop your expertise and keeping abreast of the new developments. So that's really very, very important. And it's one of the things about the American College of Phlebology, whose mission is, I think, education, primarily education. Mm-hmm. And so they offer great learning tools for diplomates and others to keep up with the changes in the field.
Okay. I remember looking into the maintenance of certification program, and so it's attending programs about new things and ongoing developments. And it's also some sort of a project that a physician has to do to make sure that they're continuously trying to improve their practice. Is that right?
Yes, there's several aspects to it. Some of it is attending educational meetings, but also they need to take a periodic exam to document that they've kept up with changes. And they also need to do sort of a self-assessment, if you will, a practice assessment and continuous improvement. So they need to look at what their experience is with their patients, look at national standards, and then modify their practice when needed to keep up with changes in quality of care.
Wow, that's a lot of things for doctors to do, isn't it?
It is.
But it really translates into better care. There are new things, as we've talked about, coming out all the time in this field. There's so much research being done, and I think it's really important for there to be some organization that helps doctors form a structure for really keeping up on things.
Absolutely. I mean, I think that really the reason that the American Board of Phlebology came into existence was really to improve patient care. And we have that as our long-term as well as our short-term goal. Okay.